joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're joined today by London Mayor Ed Holder and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. We'd like to welcome the media who are in attendance for today's briefing and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, those listening on News Talk 1290, and those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thank you, Beth. Good afternoon, everyone. You know, like all Londoners, like all Canadians, I want to express my profound sadness following the discovery of hundreds of children's remains in unmarked graves near a former residential school in Saskatchewan. The sadness we feel in no way compares to the horror, the pain, and the trauma experienced by Indigenous communities upon learning about the news. And so our thoughts are with them. Of course, thoughts alone aren't enough, especially as similar discoveries are anticipated in the coming weeks and months. Canadians must acknowledge and confront these truths. There's much work to be done, and I would encourage each of us to learn more and to take personal actions towards reconciliation. Where COVID is concerned, we've received confirmation from the province earlier today that we will enter step 2 of the Ontario government's reopening plan first thing Wednesday morning. I think it's great news for so many individuals and so many businesses, and so richly deserved. I'd like to encourage all Londoners and everyone across the region, like never before, to support local business. These last several months have been difficult and painful for too many. These businesses need our support now more than ever. Another way to support local businesses along with your family, friends, and coworkers, get your shot. Get your vaccine or your second dose as soon as possible, because we're at a point right now where we've never had a greater supply of vaccine in our region as we do today. So let's not miss our shot. Let's not waste the shot. Getting your vaccine, regardless of the brand or manufacturer, is the only way to keep our community healthy and to keep our businesses open. Just as a point of reference, I'll be getting my second shot on Saturday. I did get Pfizer the first time, and I don't know if it'll be Pfizer or Moderna the next time. And frankly, I don't care. Both are great options, and both offer fantastic protection against COVID and all the variants of concern. And that's what I care about. And I am going to ask you to encourage your friends and your family, for those who haven't had their shot, and there's still too many, and those who haven't had their second shot, to get it done and get it done now. So book your shot today. Let's continue to see those vaccination rates skyrocket while case counts and hospitalization plummet. And I really appreciate all of Londoners' support and cooperation in doing that for our families and for each other. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor, and in particular, thank you for, as you often do, bringing in an important issue that is unrelated to COVID around the discovery of a mass grave of Indigenous people in Saskatchewan. Of course, the health unit supports your comments, and our hearts go out to those families and communities that have been affected by this. On the COVID front, 5 cases yesterday, 0 deaths. We did announce yesterday that almost 43,000 additional doses have been allocated to this region. That means we'll be able to make 43,000 more 2-dose summers. With the increasing numbers of Delta variants, it is so important for people to get that second dose, and this announcement couldn't come at a better time. So very grateful to everyone in the Ministry of Health and everyone at the provincial government who is sending those additional 43,000 vaccines to our community. Those vaccines are already allocated over the next 3 to 4 weeks in our booking system. So we have a huge number of available appointments right now, including some appointments even later today and tomorrow. Most of the openings are at Agriplex and the Earl Nichols Center, where we've been able to add additional capacity to vaccinate in the very short term. Very much encouraging everyone to get out, get your first dose if you haven't got it, or second dose through those sites. Again, the booking information is covidvaccinelm.ca. covidvaccinelm.ca. People can get appointments at any of our mass clinics or the pop-up clinics that we're offering in schools right through that website. One other thing I want to mention, a huge thank you to Dr. Upton Allen and Dr. Michelle Barton-Forbes, who joined the health unit on Monday evening for a town hall with the Black community in Middlesex and London. Dr. Upton Allen and Dr. Barton-Forbes are leaders at Sick Kids in Toronto and Children's Hospital here in London, respectively, and couldn't have better partners for explaining the information around vaccines in a rigorous and also digestible way. So huge thanks to them. We did record that town hall. We had a number of participants live, but it's also available on the Health Unit's YouTube site. So we will post that link in the chat in a moment. That's it for me from now, Beth. Looking forward to any questions.
Thank you very much, Dr. Mackie and Mayor Holder, for those opening statements. We will get to the questions. We've got quite a few in the queue already. We'll get to the first one here. It is for you, Dr. Mackie. It comes to us from Jane Sims with the London Free Press. Dr. Mackie, since announcing the flood of new vaccine doses expected to arrive here this weekend, have people been snapping up appointments? How has the uptake been at the school pop-up clinics?
Sure. So yes, we've definitely seen thousands of those appointments snapped up immediately. We didn't have a large new group that we were opening eligibility to until today. So we're really hoping that media can help us to get the message out that everyone who has had a vaccine before or on May 30th is now eligible. So that's a huge new group, about 3 more weeks worth of first doses from May 9th to May 30th. Those folks are all now eligible to book their second doses. I think I've just got a little error here. I'm not sure if I'm disconnected or not.
Oh, we've got you here on our end, Dr.
Okay,
Mackie.
super. Just Teams is making me sign in again. So that's hopefully that works smoothly. Great. So so with that reopening, between May 9th and May 30th, we vaccinated something in the range of 75 to 80,000 people. So that's a large new population. We've got to get the information out to those people that they're now eligible to book, and we're really counting on the support of the media to be able to do that. So once that message goes out, and you probably have in your inbox the public service announcement that details all of that, then we expect to see many of those appointments disappear very quickly. The second question was around uptake at the school pop-up clinics. They've been almost completely subscribed, so the uptake has been very good there. Now, we did give the school community heads up, and we did have a number of young people book through those clinics. There are also lots of adults who book through the covidvaccinelm.ca website once we did open that to the general public. So, we're meeting the needs of the community. We feel great about the fact that those vaccines are moving through pretty much as quickly as we can get them out to those mobile sites. And again, we're going to continue to grow and expand our mobile options.
Great. Thanks very much for that response, Dr. Mackie. Our next question comes to us from Jacqueline LaBelle at AM 980 CFPL. This question is for both you, Dr. Mackie, and Mayor Holder. Now that we know we'll be moving to step 2 of Ontario's reopening plan on June 30th, what impact does that have on the planned Road to Rock the Park patio series? So why don't we start with you there, Dr. Mackie?
So thanks for the question, Jacqueline. This is an important event. We're very happy that we will be able to see some kind of concert series in London. That's something that our frontline staff are working with Brad Jones and his team on as we speak, making sure that we have a shared understanding of the regulations. And of course, as long as the events are planned to fit within the regulations, we'll be strongly supportive. Thanks.
Well, thank you, Jacqueline, for the question. I participated in the initial conversation that took place with Rock the Park organizers and the health unit. And we know there was some communication through the media after that. I want to say something to be really clear. This isn't about the health unit in terms of whether the health unit does or doesn't give permission. I really think that's important to clarify. This is about the regulations and direction set out by the Chief Medical Officer of Ontario as it relates to stage 2. And if the event falls within the guidelines associated with stage 2, then the show goes on. And I really hope it does. I've got tickets for it. I would very much like to participate in the show, and I'm pleased that the organizers are looking to put this together. But I do want to make it absolutely clear, this is a function of what the regulations set out by the province are about. And as long as we can accommodate that, then I think it's going to be a terrific series of events.
Thank you, Mayor Holder and Dr. Mackie, for that response. Our next question comes to us from Jane Sims with the London Free Press. Dr. Mackie, a statistical question for you. If someone from Middlesex-London receives their vaccine doses outside of the region, are they counted in local statistics? If a snowbird received both doses in the United States, does the health unit record their vaccinations?
Yeah, I appreciate the question. I always love when people are willing to take the time to understand the data fully. There are 2 different vaccination rates that are being reported. The province is reporting vaccination rates based on those given in the community. Locally, we're reporting vaccination rates based on those for people who live in the community. And because you're talking about huge data sets of literally tens of millions of people and vaccinations, it takes time and energy to get down to that granular level. So the data that you see on the healthunit.com website, that is based on postal code. So we pull the actual address of the person and include them in our count based on whether they live in our community or not. We do have access on a periodic basis to the data from across Ontario. So if someone was vaccinated, in Sault Ste. Marie the first time, but they happen to live in Middlesex or London, we would see them in the data. And again, those, we've vaccinated tens of thousands of people from outside of the region, and those from our analysis would get allocated back to the region where they live. So that when we're reporting the percentage of people who live in Middlesex and London that have been vaccinated. If somebody is vaccinated outside of Ontario, it's not captured at this point. There is a process in place to gather their information and enter it into the provincial data tracking system. But, I would say probably a very small proportion of people have taken the time to submit that information at this point. When we get to the point down the road of vaccine passports or that sort of thing, you'll likely see that increase. But at this point, if somebody were to have received a vaccine elsewhere outside of Ontario, it's unlikely that they're captured so far. We also don't think that's a huge impact on the numbers overall, given how little travel there has been over the past 6 months since the vaccine campaign started.
Thanks very much, Dr. Mackie, for that response. Our next question comes to us from Jennifer Beeman with the London Free Press. This question is for you, Dr. Mackie. How do you feel about stage 2 coming just in time for Canada Day celebrations? Do you worry this will give license for people to let loose and pay less attention to public health rules?
So, appreciate the question, Jennifer. I think it's the right time to do this. I think that we can't stay locked down forever, and we're seeing very low rates right now. So it's totally reasonable right now. I would strongly encourage people not to take advantage of that indoor gathering limit if there's any way that you can avoid it. Keep it outdoors to keep it safe.
Thanks very much, Dr. Mackie, for that response. Another one here from Jennifer Beeman with the Free Press. Dr. Mackie, given our ultra low case rates, is stage 2 too conservative of a reopening, or does it strike the right balance?
Well, so, just receiving the regulations as we speak, and so we haven't gone through them with a fine-tooth comb to say exactly how it fits with balance. I think we do need an additional level of reopening right now. We're all hoping that we've seen the last wave of COVID, but if we do happen to get one in the fall, now's the time to be out and enjoying ourselves. Now's the time to be building up our social connections, our family connections, our resilience, our energy, so that if we do have to go through another wave, we are ready.
Thank you, Dr. Mackie. And one more here from Jennifer Beeman with the London Free Press. Dr. Mackie, is a one-size-fits-all provincial reopening plan the right call? London is no Toronto or Peel.
Yeah, so I hear what you're saying and couldn't agree more that there are fundamental differences between those communities and ours in terms of how people gather, work, and play. The advantage of a one-size-fits-all provincial approach is that you have, on the one hand, solidarity, the sense that we're all in it together, and so there's no, cynicism or competition about different restrictions in different places. That's an important message. The other key thing is it helps avoid the problem that we did see of people, traveling between different jurisdictions to try and avoid or take advantage of different restrictions or loopholes. And that's a huge advantage. There are some places where the local medical officer of health may add additional levels of protection around, section orders, class orders, but that we don't anticipate needing that here. I think this plan is reasonable for Middlesex and London right now. And of course, we'll watch the data very carefully to make sure that if anything changes, we're able to react quickly.
Thanks very much for that response, Dr. Mackie. I did just want to mention that public service announcement that Dr. Mackie had mentioned earlier in the beginning of the briefing, it should all be in your inboxes by now. So if you've got a chance to take a look at that, we are just down to one more question here and a bit of time left in the briefing. So there is a bit of a delay. Certainly, if you do have any remaining questions this afternoon, please be sure to get that into the queue as soon as possible. We have another question here, Dr. Mackie, from Sophia Rodriguez with CBC London. Dr. Mackie, do you expect the health unit will be able to match the province's vaccine booking system and open second dose appointments to everyone by June 28th?
Yeah, so thanks for the question. June 28th is Monday. We certainly hope to be able to open to everyone Monday. It really depends how the next few days worth of appointments, how they go. So we'll be watching the numbers over the weekend. If we run out of appointments by Monday, which is entirely possible when you've got 80,000 people rebooking into 43,000 new spots, then it will be difficult to open any further. And, we could do it on paper, but it wouldn't be really meaningful because the appointments wouldn't be there. So if we do have 10, 20,000 appointments still available, haven't been snapped up, there's no reason not to reopen further. One thing I want to be sure to point out, and I should have mentioned this earlier, but people cannot book earlier than 28 days after their second dose. So even if you are eligible to rebook earlier, you still have to wait till 28 days after your first dose, and you will be declined at the clinic if you come before 28 days after your first dose. Really would appreciate help from media getting that message out, because this morning we already saw people who kind of got the message through the grapevine yesterday that we might be reopening today. We already saw people come into our clinics this morning who had booked through the system. They ticked off the box and said I'm 28 days after my first appointment, but they actually weren't. And when we get to the clinic, we can't give them the dose. So people need to be at least 28 days after their first dose in order to book their second dose.
Thanks very much, Dr. Mackie, for that response. Well, no more questions in queue for us this afternoon, so we will wrap today's media briefing. Thank you very much, Dr. Mackie and Mayor Holder, for joining us. And again, the public service announcement that Dr. Mackie mentioned earlier should be in your inboxes to take a look at. We'll be back to join you on Monday, June 28th. So until then, have a great weekend.